anterior elevation and posterior depression. Now I want you to watch me scoot, okay? And tell me what I'm doing right here.
Anterior elevation.
And posterior depression, okay? All right. Anterior elevation, posterior depression. Anterior elevation, posterior depression. At the same time, the other hip is doing just the exact opposite. All right. Okay, gait. All right. So we're walking. All right. We're coming with
Anterior
elevation, and right here we get
Posterior depression.
posterior depression. Okay, at the end of the stance. All right. So they're very functional patterns that we use, and they're part of the D1 lower extremity pattern. So flexion and extension. All right, Monica's my patient. I've identified that she's missing both components. All right, she's missing anterior elevation. We're not able to scoot. She doesn't have really good flexion or extension of this hemi left lower extremity at this point. So I'm going to kind of get in the motion of what I need to be doing here with her. And I'm going to explain to her what we're doing. Monica, I'm going to be moving your hip through a couple patterns, okay? We're going to be kind of pushing it up towards the front of you, and then we'll be pulling it back down towards me, okay? All right, so I just want you to feel this. My hand placements are going to be over the ASIS and the ischial tuberosity, all right? Okay, I want you to stay rolled over onto your side. All right, we're just going to move up. There you go. You don't even have to help me, but that was really good. Good job. So, you know, she wants to help me, but I may passively have to move them through this motion in the beginning, all right? So I'm passively moving her into anterior elevation.
It's harder to relax.
It's hard to relax, and you may be a little ticklish, aren't you? No. A lot of patients are ticklish.
I'm a helper.
You just want to help. She's a help. She's just a helper. That's okay. So we're moving her into anterior elevation and now back down into posterior depression. Okay, but I'm just going to do one at a time. So once again, my hand placements have now moved off of her ischial tuberosity. We're just going to move on up into anterior elevation. Monica, I'm going to just stretch you just a little bit back towards me, okay? So I'm going to move her this way. Hold on, I need to get on top of your iliac crest a little bit better. I'm going to move you back towards me. I want you to pull that up and in towards my fingers. Good job. Beautiful. Just relax. This time I'm going to give you a little quick stretch and pull up and into my fingers. She's got really nice, she's got nice abs right there. Just relax. You want to make sure, that they're not doing too much rolling. If you're starting to see a bunch of compensations, they're starting to flex up into flexor synergies in their trunk, and their arm is starting to flex up. You're giving them too much resistance, okay? So we want to make sure that we're easy on the resistance. Just relax. Good job. And pull up and into my fingers. Good job. Beautiful. That was fantastic. Now we're going to move into the other one where we're pushing down. So I'm going to have to back up here. I'm going to get right over her ischial tube. I'm just going to, okay, right there it is. I just got to find it, that's all. All right, so what I'm doing here is I'm going to push her back up into that position, okay? And now she's going to push back down and out towards me. Monica, push her hip down and out towards me, okay? Good job, good. And relax. Now she's got a lot of pelvic mobility, which most of your patients won't have this much. Okay, let's do it again. Push down and out into my hands. And good. Now relax. I'm going to give you a quick stretch here, okay? We're going to stretch and push, down and back. Push. Good. And relax. And push down and back. Beautiful. All right, good job. Okay, so any